But I'm gonna take an opportunity to say, like, you know, when I listen to her story, even if I know it, it reminds me of what a strong woman she is, and you know, and all the things that she went through. And that was a great opportunity to open the conversation. Christina mentioned cross-dresser. That's how some of us started cross-dressing. I remember being 18 and not knowing. So what did I do? I started cross-dressing. And then she mentioned being queer before that. And then she mentioned wanting to become a transsexual. And then they mentioned her being a transgender. So what can we take away from that? We can use the word transgender or gender non-conforming, which means that you're not okay with your sex of birth, was assigned to you as sex of birth, and your gender came to be something different. And we can use the term transgender as an umbrella that can cover every kind of identity in a minute. Identities as a female to male, transgender, a male to female, transgender. Somebody likes to call themselves transsexual, and that should be okay for them. You have to respect. If somebody want to call themselves transsexual, should be okay. Pre-op, post-op, somebody that went through sexual reassignment surgery, so we can put them all under a transgender umbrella. Trans men, trans woman, genderqueer. Genderqueer, I don't identify with any gender. I don't want to be put in any, box. So cool, no problem. Let me give you the best services that I can, right? Bigender, gender fluid. Some people fluctuate their gender, and one day feel more masculine, then one day feel more feminine. Butch, we have like many, and it's a lot more terminology that is not here. Well, we're trying to say that gender, what goes in between the idea of being a male and the idea of being a female, it is a lot of things in the middle that we have to consider. And sometimes people that are gonna come asking for our services, they're not gonna be all the way in the masculine with the masculine idea, and it's not gonna be all the way in the feminine idea. They're gonna be in the middle, and we have to address that. Does it make sense? You were gonna say something, sorry.
Yeah, I'm talking as a parent.
Yes.
Because I have a 23-year-old daughter who has just come out, and she pretty much dresses like a male. She doesn't dress like a female anymore. She cut her hair really short, and I've had issues with family members, and my own mother, who's 72, and she kept, tormenting my child, saying, I thought I had a granddaughter, I didn't have a boy, grandson. And finally my child just, walked over to my mother. She says, okay, she unzipped her pants and that, and she says, I was born with a vagina. Just because I dress masculine doesn't mean that I'm a boy, and you need to stop calling me that. Because they were calling, her name is Alyssa, and they were all the family was calling her Alan. And they were teaching my grandchildren to say, hi, Uncle Alan. And I'm like, that's not fair, that's not right. And it's not just that the hurt of the child, because I hurt for my child, but it hurts me as a parent because I'm new to this, and it's hard for me. I've had gay friends all my life, but to have your own child, and then have other people hurt your child, it's very hard.
It's very hard. But how important it is that you have been able to address this issue, and how important it is that your child had an opportunity to say, stop putting me in this box, or stop putting me in this box. This is who I am, and this is what I want. And that is called empower. That is somebody that has the power to say, this is who I want to be. Because usually when you were born with a certain sex, and then you keep going that way, like let's say somebody was born a female and still consider herself a female, doesn't have this kind of problem. For somebody that does have this kind of like, issue, and like to present in a more masculine way, and like your daughter still consider herself a female, but likes to explore all the masculinity that may be interested in, should be addressed, and this person should be empowered to live her life as she wants.
Right. So deep into the services, so because we're gonna have it very limited.
Sorry, I get
No, but it's good. It's good that we're bringing a lot of important stuff. But let's dive in to what you do to help people who are dealing with that, CEClLlA.
That's why Christina is awesome, because she always brings me back. Otherwise, we will be here at 10 p.m. So, what do I do? What my program does? 3 components. Medical services. Everybody needs to make sure that the physique is okay. Mental health services. Everybody should be sure that up here is okay. And supportive services. Care coordination. And that's what I do. Next. See how fast I go? Back on top. So what do I do? What do I do as a care coordination when it comes to a transgender person? I facilitate and communicate the communication in between the medical providers and the patient. Clinical staff, mental health staff, and everybody else that is going to come across this trans person. So let's say you're a trans person, you need a referral, to go to see a podiatrist. I'm going to communicate with the podiatrist. I'm going to say, I'm going to be sending you, I'm going to totally put you in a spot, Brooke. I'm going to be sending you Brooke. You may find another name in her card, so she wants to be as Brooke and as a she. So what do I do with that little short phone call? I'm making Brooke feel more comfortable to go to the podiatrist and get that food in good health. Right?
And I will come back.
I know.
I feel great.
I also have to take care of everything else. I work a lot. Entitlements. Do you have insurance? Can we get you insured? Are you uninsurable? Let's take the long way. Let's get you an immigration status. Let's get you insurance. Let's get your coverage paid somehow. Specialty referrals. Your PCP, your provider, may send you to different doctors. I make sure that every doctor that you go to is trans savvy or is understanding.
There you go.
So how do I do that? I provide trainings to them. Housing. Unfortunately, I see this every day. Oh, hey, CEClLlA. And I go, hey, what's up? They go, nothing. My mom just kicked me out of home because who I am. Housing. It's a lot of housing. Can I give you an apartment? No, I can't. But I can find you a shelter where you can be addressed as the gender that you want. My work is a lot about connections and referring people to the right places. Name change. Some of us, let me finish. Let's go. Just it.
I just wanted to ask, what are there any shelters in the city that you refer to the most? Because I've worked with people with trans experience in the past, referring them to shelters and been
And towards the end, we're gonna.
Towards the end, we can have a conversation and we can give you some awesome referrals for that. All right? Just make sure that you talk to me, Christina. Name change. Some of us want to change our names. Some of us, I did change my name a couple of years ago. I was just tired. I was just tired of going to an airport and they would call, I'm totally disclosing, Alejandro, that was my name, and when Alejandro wake up, go like wait a minute. You know? So I changed my name. So when they call CEClLlA, I go like this, and nobody say nothing. So if you want to change your name, I help you with that. Some of us want to change our gender marker. You know, again, the club. I don't go to clubs no more, but if I happen to want to go to a club, you know, you always go to the, They look at your ID and they see an M, and then they see you, and then it's a whole discrimination thing in the middle, you know?
Ladies' night.
I've been asked to, like, not to get inside the club many times. So, yeah. And some of us want to change our gender marker, so I help you do that. I draft a letter, I get it signed by a doctor, I take you to Social Security, and I stay right there, and I go like, yeah, change it. So, but that comes with other whole idea of problems that we have to discuss with clients. Like, let's say, for example, if you were born a female and you change your gender to male, God forbid, you get like ovarian cancer, nobody's gonna treat you because you have an M. So you have to have a conversation. It involves a whole conversation. Let's say I get prostate cancer, nobody's gonna treat me because I have an F, right? So when I changed my name, my gender, I made a decision, but it came with a lot of thinking, you know? So you have to, it's not just, oh yeah, let's change your gender. You know, it may come with some barriers also. Immigration, you know, and that's where I have my heart. I was an illegal document for like 10 years in this country, and I live a reality. And you know, so now when somebody comes, like, you know, my supervisor was like, oh, why do you spend so much time with this person? I go like, look at the document, at the legal status box, and you're gonna see that that's why I put a lot of effort, you know, to my people.
There you go.
And I do my best. And sometimes I win, sometimes I don't.
But you're there.
Yeah. And I co-facilitate groups. Ooh, she moved me already, okay.
I'm supposed to be quick.
Yeah.
The second one that you just ended with, the changing of the sex. Okay, so suppose the female changes to be a male, name and everything, but then they end up with ovarian cancer. How do they become treated?
That's when I come handy.
Or that's when you will come and help.
Yeah,
Okay.
that's when I come handy. Because I will call insurance, I will find you a doctor that can treat you, I will do anything. And you may not know, but if you have a client in that situation, you can always reach out. You know, from now on, one of the best things that you may take with you is going to be Christina's information and my information. So it's okay not to know all these resources, and it's okay to know that the best thing that you can do is reach out for them because they are there. It is resources.
Okay, thank you.
Physique, your body. What my agency do? Yes,
I have
baby.
a question. I changed my name legally, okay?
Good for you.
And I'm trying to change, I want to change my name on birth certificate. They want to do that. But to put F on the birth certificate, you have to have the surgery, right? So why do they want documentation from the doctor?
We should have a conversation after this because it is ways. But we can have we have a we can have a conversation after this.
Do you know how to get around that?
Just you and me. We can call it that way. Yeah.
That's what I'm talking.
I am the one writing the letters, so you know I always.
CEClLLA.
Cecilia.
Go back to the presentation.
Okay, I'm sorry, I'm taking too long. Primary care. What is primary care? In your first visit, you know, you go to a doctor, and in my clinic where I work, we ask you, what was you born with? What is your sex at birth? What is, you know, the gender that you want me to address you to? What is the name in your documentation? What is the name that you want me to call you? And then they come at the 10,001 questions, that is the intake, you know, and then it comes the doctor asking you all your history and asking you what's going on with your body. We do labs right away. We do a lot of vaccinations. Why? Because primary care is about preventing. So if as much as we can give you vaccines for everything, we do. And we do hormone therapy. The famous hormone therapy, yay, the one that most of trans persons want. Many of us don't want hormone therapy, but if you do want hormone therapy, we do it. Being a unique patient, what is hormone therapy? Hormone therapy is crafted to everybody one by one. It's not just one way to do hormones, it's many ways. And usually hormone therapy goes with the person. What do you want? What result do you want? How do you want to do it? How long do you want it to take? And then we craft a treatment with hormones that is fitted for you. Transition process. What the medical provider does, primary care is about preventing and screening. Primary care is about having a place where you are sick, you can call and see a doctor the same day. Hormone therapy again. Follow-up and monitoring. You know, the timeline is as unique as you. We can ask you to come every 6 months, we can ask you to come every 3 months, we can ask you to come every month until we make sure that you're okay. How do we do this? Very open and respectful communication. And you know what? One of the things that I always say to my clients in the first visit, you know what? I don't know everything. I may make mistakes. Just take the time to respectfully correct me. You know? And I'll take it. Let's do this together. She changed me already. Mental health. I'm going to do it to her. Trust me.
We have a lot to
Mental
get
health
to.
service. We have an initial mental health. Some people believe that to start hormone therapy, you have to go to a psychiatrist. And, you know, it's very simple. The hormone treatment, how we see it, it comes with a consent. So as long as you're consenting for therapy, you are allowed to start hormone therapy. But we're also going to make sure that you're okay here. What's going on here? Do you have depression? Do you have anxiety? Do you have issues that you want to talk about?